Professor Wale Oke joins us now. He is the Chief Medical Director in LASUTH, that's Lagos State University Teaching Hospital. Thank you for coming on this morning, Prof.
Thank you very much.
Well, already we have two people disagreeing and so many others. John Doe says effects of energy drinks or coffee are safe unless they are taken with other things like alcohol, drugs, cigarettes. But Bisola Abayomi says energy drinks contain a lot of ingredients that are considered doping agents. They are very dangerous to health.
The answer to the question should actually be gotten from research.
Okay.
Okay. I think we should treat those energy drinks as drugs. Now, when a drug is being brought to the country, it goes through NAFDAC.
Yeah.
NAFDAC would get this drug across to a group of doctors who would investigate it and make a statement on it, whether it's safe or not. The issue with the energy drinks is that they're treated as beverages and they come in. I had an experience with an energy drink. I was en route to Mozambique for a conference, and I stopped over in South Africa. And I had to catch up on a few things I had to present. So I bought one at the airport. They are freely sold at airports. I consumed it, expecting...
airport here or...?
Airport in South Africa. I was trying to catch up on some of the things I had to present at the conference. I consumed it, and I got to the lounge, got on the internet. I couldn't sleep. I couldn't concentrate. I couldn't do anything. In fact, I had to go and take a shower, and I still didn't feel better. Now, they contain what we call sympathomimetics, caffeine. Now, the body has a sympathetic system and a parasympathetic system. The sympathetic system is the one that is challenged when you are undergoing an emergency, a crisis. You want to flee or you want to fight. So your blood pressure goes up, your pulse goes up, you don't make urine, you don't feel hungry, okay? Now, when you take energy drinks and you're hypertensive or you have some cardiovascular problems, I envisage that it's probably going to raise your blood pressure to an extent which is probably going to be dangerous for you. It's going to increase your heart rate, and sometimes it can give you abnormal heart rate, what we call arrhythmias. Now, the worst kind of arrhythmias is atrial fibrillation, where the heart completely goes chaotic and blood doesn't flow that effectively. So when you keep blood that's not flowing, what happens? It clots. So if you have extensive atrial fibrillation, it can actually lead to a clot. Hitting the internet, I found that some non-sugar types of energy drinks, I don't think those are sold here because Nigerians like sweet things. Non-sugar energy drinks are actually being linked directly with clot formation. Wow. Okay, and in Europe, 4 or 5 countries have actually banned it.
Outright.
Okay? Outright. I know maybe Norway, 1 or 2 others have banned it. Even in, is it Uruguay or something in South America? Now here we've taken it in because it's a fad. People use it to get to keep awake, not knowing what internal damage it's causing. I would say legislation should be passed to have it investigated. You would send it to any hospital or all the teaching hospitals in Nigeria so that we have a larger population base and we can make a statement, a conclusive statement.
Will that be widening the scope that NAFDAC already does?
I'm not sure I'm calling them drugs now,
okay, because
they affect the human body. I'm not sure they were investigated because they were taken to be beverages like Bonvita, coffee. The bad thing is that I found that a lot of people take it with alcohol. Yeah. Now, alcohol to an extent is a depressant, okay? And all these energy drinks are stimulants. So you're taking 2 different
So one is
drugs,
struggling to depress you, the other wants to take you up.
and that can totally disorganize the system.
That's a big fight in you.
Big fight.
Oh dear.
So these are the issues we have to consider. They are already in the country. Honorable Alibiyoshu is in a position to force an investigation, which I think is really necessary.
And part of what makes it worse, is that many people don't go to the hospitals to do general checkup. People don't even know if they are hypertensive. And then some cases, the active ingredients of these drugs are not stated. And then you just take them, not knowing, and then you just move on, and before you know what's going on, there's crisis.
Unfortunately, the active ingredients are stated, but people don't read them. And that's what we need to get our people also to do. When you buy anything, take a second to read the ingredient. But sometimes the contents are disguised, like sugar, there's energy. Okay? So you actually read them and you don't really understand. But a lot of people use it because a friend will have told them,
this is good,
use it. Take it, you can walk for 4 or 5 days non-stop, and you'll be at the top of your profession.
So in other words,
but unfortunately, the more you walk, the less efficient you get.
I'm trying to take it from where Chamberlain stopped, talking about most Nigerians or most people not going out to look out for their health status to know how healthy they are. And you just pick this off the shelf and you consume it not knowing you already have some health issues with you. That's a big risk, isn't it?
Very big risk. Most times, the first time a patient knows it's hypertensive is after he's suffered a stroke, or when the kidneys are down and he needs dialysis, or indeed when he has a heart attack. You cannot legislate that people must go to the doctor by force. But I think we need to spread the news and let the people know that the general law is that once you are 40, you should go to a doctor for a full comprehensive at least once in 2 years. When you are 50, it should be every year. When you are above 60, it should be every 6 months. Because as you grow older, the non-generative disease incidence increases. Cancer rates increase. Okay, by the time you are 70, the possibility of having cancer is almost double or triple. So you need to do that. The doctor is your friend. Sometimes when I tell my patients, when you go to see your doctor and he says you're hypertensive, there are some specific tests he has to carry out. These tests, some of them might be expensive. You are not making money for the doctor. You're actually securing your health. You understand? And because some of them are very expensive, and because of the level of the financial situation of the patients are, sometimes it's difficult. But the good thing is that we are beginning to have the insurance scheme, which hopefully in the next 10 years will become comprehensive and will be far-reaching, and all Nigerians will be able to accept it. Once you have that and you are paying premiums that are affordable, then it will be no fear for you to see a doctor.
Not leaving the main issue, which is the energy drink, looking at how safe it is again. What would you advise the average Nigerian do about his health? If you say some of these are expensive, what's the cheapest? He can get?
Measure your blood pressure. We always say know your numbers. Your blood sugar, your blood pressure, and your cholesterol. Those three are by far the most important 3 figures you must know. Your blood sugar must not exceed 100 milligrams. Your cholesterol must not exceed 180, and your blood pressure must not exceed 140/90. So if you just go to your doctor, even a nurse can measure your blood pressure. Qualified nurse will be able to measure. Once it exceeds 140/90, you know there's trouble. And that's enough reason for you to see a doctor. If your blood sugar is above 100, you may be diabetic. You should see a doctor. And if your cholesterol is above 180, then you need to see a doctor as well.
And for those who are healthy, by the time they consume this, for instance, they now lack sleep for, let's say, 48 hours. What's the risk in all of that? If you
the risk is sleep? Exhaustion, one. Those guys will go back to bed and sleep for 2 or 3 days. The blood pressure is high, the pulse is high, the heart is working full capacity and can actually beat abnormally, okay? And the patient can actually collapse. The patient can actually have a heart attack or a stroke. Or if he does it on a continuous basis, when the heart overworks, keeps working, it fails. And then the patient notices swellings in the feet, he gets easily tired walking up the stairs. A lot of people confuse heart failure and heart attacks. But heart attacks can cause heart failure. Heart failure just means the heart cannot cope. And so the patient just gets worn out. There's fluid in the lungs, there's fluid in the body,